Welcome to Glass Half Full with Leslie Krongold. She shares her stories, experiences, and knowledge of living and coping with a chronic health condition. Learn about tools and resources and hear inspirational interviews that help you to live a life filled with quality and dignity. With 2 decades of support group leadership, Leslie's ready to help you make lemonade out of life's lemons. Are you ready?
Today we're going to focus on self-care. Perhaps everything I talk about on this podcast can be called self-care. What I mean is really anything we intentionally do to take care of our physical and or emotional well-being. For me, that's eating a healthy, predominantly plant-based diet, drinking lots of water, practicing yoga, Pilates, and Qigong during the week, staying away from toxic environments, whether it's a noisy, loud, and crowded event or individuals that have strong negative energy. It's everything I do to limit any stress in my life so the symptoms associated with my chronic health condition are not exacerbated. And self-care for you may be entirely different. Though I don't want to come off as judgmental, but even though certain behaviors may temporarily make you feel good, like smoking a cigarette, eating a cheeseburger, or drinking half a bottle of wine, they're not necessarily indicative of the self-care that's best for someone with a chronic health condition. That's like a really soft way of putting it. They're not good for you. That's what I really mean to say. I think we all know what healthy behaviors are. I think the issue is how much control can we exercise to implement good self-care. But I won't delve into motivation and discipline. This is just the beginning of our exploring self-care. In the first podcast episode, I talked about self-management health behaviors, which I think are synonymous with self-care. Which behaviors do you practice to make you feel better? It's something you do intentionally related to managing pain or fatigue, breathing techniques, relaxation, and managing emotions, nutrition, and exercise. And self-care is not just for someone dealing with a chronic health condition. Self-care practice is for everyone. My guest, Valerie Jew, will talk about self-care for service providers, doctors, nurses, or teachers, anyone who helps provide care for someone else. So I do a lot of self-care, and I'm generally open to learning about new modalities of self-care to add to my toolbox. In fact, in my toolbox, or rather the purse I carry with me out in the world, I have an aromatherapy roll-on I'll use if I'm feeling a little stressed out, like I did yesterday at my dental appointment. The smell of lavender rolled on my temples and underneath my nose, for me, is very soothing. I also have these hard ginger candies, which I find effective if I have some mild digestive distress. And when I travel, I bring a huge array of tools with me to help with all types of self-care needs. In my pursuit of learning more about self-care, I meet various practitioners, and one of those is Valerie. I met Valerie about 2 years ago at a fundraiser for the Piedmont Yoga community, which Joan talked about in episode 5. It was a spa day that included yoga classes, massage, and Reiki therapy. Valerie gave me my first Reiki treatment. It was a memorable experience which I was able to repeat less than a year later at another local event. Subsequently, I learned that Valerie is part of the Urban Zen Foundation, and her work involves not just Reiki, but several other healing modalities. I invited Valerie to speak at my support group meeting, and her presentation focused on essential oils for fatigue, anxiety, depression, and gastrointestinal distress. The meeting was well attended, and everyone really appreciated all the wonderful scents and how they assisted with a deep sense of relaxation. About 3 months ago, I noticed that a class called Urban Zen Integrative Healing was offered on Mondays, so I thought I'd give it a shot. And sure enough, Valerie teaches the class. It's held at the Ed Roberts campus in Berkeley. The campus serves as something of a community center for people with disabilities, and about 15 different organizations providing resources or services to the disabled community have their offices in the building. This class has become a little community of people with various issues: cerebral palsy, hearing loss, cancer, cardiovascular disease, old age, and Valerie helps each of us provide an hour of deep relaxation and healing. I invite you now to listen to our conversation about self-care and urban Zen.
So the way that I got involved is I lost both my mom and dad within a year.
Oh.
And one summer, Urban Zen was happening in New York, down in Manhattan, a big, huge training, their very first training. And a special person, Joan Halifax, came to talk, and her whole work is around death and dying. So my brother, and some people may not know this, but my brother Rodney told me, you've got to come out and hear Joan Halifax speak. Sort of in relation to us losing our parents. So I joined the Urban Zen group in the summer. I heard her talk, and at that point I said, this is something I really want to do. I was still working, but I wanted to also start to launch myself with Urban Zen as an integrative therapist. And so in 2010, I went through the accelerated training, and then I brought it back to the Bay Area.
So prior to that, had you been doing yoga or Reiki or any of those modalities? Was that part of your life?
The yoga was part of my life, but it was sort of kind of touch and go. I mean, I was very much a part of my brother's life, who's like my twin, and the retreats that he would go on, I would go on. I would go to the studio and I'd take classes from him, and, of course, exposed to it in the home as well. And so definitely yoga. I wouldn't say that my practice has been a steady practice or, any 200, 300, 500 hour training, just my own kind of interest and development. And then from there, after I got my accelerated training in Urban Zen, I decided to expand and study Reiki under a master here in the Bay Area. And from there, it led to being part of the training staff down at UCLA with the medical center there, and bringing Urban Zen into the UCLA Medical Center.
Oh, so is it part of that, a program down there now, currently?
It's currently running. We trained quite a few doctors and nurses, just trying to get them back to a way of self-care. And that being the foundation, and then also to kind of rediscover their own job, like relating to others and providing self-care for patients that they may be in touch with. So yes, it's currently running down there.
So all of your teaching experience in public schools has been with kids with disabilities?
No.
Oh, okay.
Yeah, I moved after that. Went home, took care of my kids for 7 years, and then decided to go back into the work world.
And then they were out on their own? At 7 years old, they were out and working jobs?
I wish. No, then the only job that was available was computers. And at that time, it was the little Apple IIe's, and I figured, okay, it's just a tool for teaching. So I said, I can do this, and self-taught, and from then on, it was being technology for a long time.
And what does that kind of teacher call? Resource?
They call them IT people, IT specialists. So, yeah, or computer teacher. That's what the kids call you. Hey, computer teacher. Remember, my name is Miss Jew. Computer teacher? No.
So anyhow, I know that you still work with kids, right?
I do. I still teach yoga in the schools, and I work with young kids, so they're elementary school kids, mainly in Piedmont.
Okay.
And then I have a few private sessions where I'm working with kids as well.
At their homes with
Yes.
yoga And other modalities? Or?
Mainly the 5 modalities that we weave, that when we call it integration, it's really the Reiki, the aromatherapy, the body scans, breath awareness, and movements and restoratives.
Ah, okay.
Yeah,
That's
so
good. The
all
5.
of that.
I didn't realize that.
If you really count it, it's really 6 when you talk about restoratives and movement. So, yeah, always weaving those modalities together.
So, what is tell me the birth of Urban Zen? When, where, how?
In 2009, Urban Zen was launched, and it was really a vision and dream of Donna Karen's. Her husband had cancer, and at the time before he passed, he asked Donna to find some way to take care of the nurses and the doctors and to give back to them. So this was her way of giving back to the nurses and the doctors in the hospital. It was launched with a panel of people who really did a lot of work in putting together the manual and started in New York. It's an integrative study, and that's the word that I like the most is integrative, because we have modalities that we train in separately. So we definitely have an aromatherapy piece. We learn about essential oils, the history of essential oils, the production of essential oils, things about therapeutic grade, and then what oils would be best for particular symptoms. Our symptoms really pretty much focus on pain, anxiety, nauseousness, insomnia, and constipation. Mm-hmm. So we call it the panic model. Then we all receive Reiki training, whether it's level 1 or we want to advance on to level 2. Some people go further into being a Reiki master. So aromatherapy, Reiki, body scans and breath awareness. That's just something that we practice, basically language, the appropriate language, and being able to facilitate or help the person come into the present moment by doing those. Simple movements, so if you have somebody who's in a hospital bed, then it may be very simple movements, movement of the head from right to left, maybe lifting the shoulder slightly, or even just touching finger to finger, depending on where the person is at. Some of the classes I teach, we are actually doing very beginning yoga movements, downward dog, tree pose, upward dog. So it really depends on the person that you're working with. And then definitely restorative poses, because we know that when the body is resting, that the body does its best healing then. So we really encourage the restorative.
And how would you describe Reiki?
Reiki is...
Even for me.
Yeah, I mean, there's a mystique about it. So it is an old Japanese form of body work. And if somebody is very, very unfamiliar, I kind of try to pair it in their mind with massage, because it helps to facilitate, a circulation, a digestion, a healing of the body. And it's done by either a very light touch or hovering the body. So whether you're touching a person's body very lightly or hovering, it still has the same energy effect. And then certain positions along the body. But it doesn't really matter where you lay the hands, because wherever the body needs that healing touch, the energy will go there.
Would you say of all the other modalities, maybe that one is the least understood in America?
It may be the least understood. I mean, the foundation of Reiki is, of course, it's from Japan. And we always talk about the lineage when we learn Reiki, so how far back that teacher learned from that teacher and that teacher. So there is, again, a little bit of mystique, but I would say that, for instance, when I'm in the hospital and I'm working with a patient, I would say that the 2 strongest modalities, whether they've had experience with Reiki or not, is Reiki and aromatherapy.
Wow.
There's something profound about not really even touch, but the warmth that comes out of the hands when we're moving lightly over the body. And it's something that's lost, I think, nowadays, is just that kind of deep dedication to somebody else. And that, again, would be through touch.
It just, by limited experience, it does seem much more intentional than most massages that you get, because often the massage therapist, you can sort of sense that they're thinking of what they're going to do, after they leave the massage. They're doing their grocery list or something.
Yeah, the massages that I've had, usually like a full body massage, there's just sort of this rote movement. So top to bottom or bottom to top. But with Reiki, again, we can just either hold the top of the head, or we can be hovering the heart, and that might be for a lot longer than a masseuse would spend on any particular part of the body. We could go from, seconds to minutes, and again, just by hovering the heart, the entire body's being treated. So there is definitely, I think, a difference, different in intention as well. We know that smell is really important for people. It tends to transport them to a time in their life. And if not transport, like the smell of cinnamon may remind you of Christmas or some holiday because of the baking that somebody did in the house. But we also know that there are other essential oils, which are pure grade essential oils, so they're all plant-based, that may help a patient come to a level of calm. Or like when we walk into the hospital room, we know that they've been surrounded by medications, by certain sounds, sort of the hustle and the bustle. There's the bright lights. And sometimes, like this last week, I worked with a patient who her favorite smell, oil, was lavender, and I just happened to bring lavender that day. And as soon as they smell that, there's a dropping in, there's a release of all that tension in the body and the mind. And so an oil can really help facilitate this ease. And it might be just by placing it on our own palm, our own hands, and it fills the room. Or we may leave it on a Kleenex that we leave with them as we leave the room.
When you say you go into schools with urban Zen, what is, I can better sense of the purpose of in hospitals, but how what happens in a school? Are you working with kids in special ed classes, or
kind of a lot of different levels? So when I received my training, I thought about this panic model, treating symptoms of pain, anxiety, nauseous, insomnia, constipation. I thought, this is really something that can be brought into the education arena, knowing that teachers they're in service as well. Doctors and nurses are in the field of service, teachers are in the field of service, and there's a lot of burnout. So I decided, why not bring it into the schools? And my main focus originally was actually the teachers, and it still is. I work in the Oakland Unified School District at a continuation high school, bringing weekly, I call them yoga classes, but they are definitely urban Zen integrative therapy classes, teaching a number of summers in the summer school program with Piedmont, and working with children who do have special needs and also other children. And it's really successful because mindfulness is such a huge emphasis in the schools all around the country now.
Oh, is it?
Yes. And I really feel that beyond just being quiet in the classroom, how else can you give a child a way to be able to pause and stop and have a little bit of downtime? And so that might be through just smelling lavender, or just feeling, I have a group of kids that love for me to touch their feet. So they're always, are you going to touch my feet today? So
Aww.
Yes, of course I will. So the Reiki, and I don't always call it Reiki, but they love that sense of touch. And then a restorative that allows them to have a little downtime in the day. It's been wonderful to be able to discover another part of life where you're giving back. And I'm retired now, so this coming summer I have been retired for 2 years, and most of my time is really devoted to health and wellness and the gift of life for people. And whatever small part I can play in that, just a realization and awareness, even the awareness is a huge thing, but to be able to give them small things that they can, during the day, just putting their head down on the desk and having a break. So even the smallest things I'm hoping is a gift, and it's been great to be able to be on this journey, this path.
In terms of training for Urban Zen, how often does it happen around the country? Who is coming to the training? So there are two questions.
We draw a large walk of life. So it's not necessarily just doctors and nurses, but teachers, administrators, CEOs. So whoever's really interested in kind of finding a little bit, like I said, common ease in their life, and then to bring it to their office or their staff. So the trainings are happening all the time, and if it's not here in California, then you would have to fly back to New York once a month and do it there. But they are definitely happening, and it's accessible for everybody.
Well, so you say different people go through the training, not necessarily someone who has a family member who's very ill. Do people go through the training just to discover a way to handle their own relationship with stress?
I think that when you're involved in the training, you don't think you're going for that reason. Like the last thing you're thinking about is yourself. And the basis of the training is self-care. So when people are asked to practice or do homework or to do reading or to look at themselves or to fill out, am I happy? Am I not happy? It becomes, oh my gosh, I'm actually thinking about myself. But we feel Urban Zen, the focus and philosophy is really, if you don't have self-care, you can't do other care. And so that's why there's a big piece on self-care, is because if you're able to find a sense of ease when you're in chaos, then you're going to be able to offer that to somebody else.
So caregivers should be like a prime audience.
Yeah, caregivers would be a wonderful audience. That's another part of the population that's giving all the time. And there's, you wouldn't necessarily call it burnout because it's probably your mother or your aunt or uncle, but there's burnout.
In my community, people with myotonic dystrophy, there are caregivers that are taking care of, they're unaffected with the condition, but they're taking care of perhaps their spouse, their adult daughter, and then the daughter's children who have the severe form, the congenital form. And I've just met so many, mostly women, but a few men like that. And they're amazing. I mean, they're amazing that they keep it together, but I know they struggle with it. So this would be a gift for them, that's for sure.
Yeah, there were some nurses down in UCLA who, that's what they do, is they're taking care of people. They feel like they're doing a really good job. But when you start to ask them to take care of themselves, they would say, I've just rediscovered my job. This is like the job that I always wanted to do, and I've forgotten that piece of it. And so sometimes it really, like you were saying, well, do people think about themselves? No, they don't initially, but the light starts to turn inward, and it's like, oh, yeah, I've been neglecting myself, and I really do need to find ways of taking care of myself so I can take care of others. There's a wish of mine that some doctors would, or hospitals would, see the validity, and I think it's very much happening, of treating people as they're going through chemotherapy or radiation or just prior to be able to lower the blood pressure or the anxiety, to, again, that sense of touch while they may be sitting in the chair and this fluid is draining into them. Yeah, or just holding their feet. Because we know that when we're holding the feet, that there's a grounding that happens. there's, especially for anxiety, that's kind of one of the parts of the body you want to make sure and attend to, is the feet, to ground the body and to ground the mind. So I think that, pretty much all we're definitely paying attention to a lot of things that are out there, medical or non-medical.
Are you aware of how you have changed at all through this process?
I think, I know that when I'm giving, I'm getting. There's so many times when I Reiki a person, and after I'm done, I feel like I've Reiki'd myself. It has helped me to look at the world differently, in a really good lens, a lens of, again, just that there's a lot to do. There are a lot of thirsty people, and I have something, and I want to give it away. And so that's really what it's been, and it will be. I mean, this is definitely a journey and path that I want to stay on for as long as I can. As long as I can.
Great.
Yeah.
Well, thank you.
Thank you for listening to Glass Half Full. Leslie invites you to leave a rating and review on iTunes. This helps spread the word to others dealing with chronic health issues. For show notes, updates, and more, visit the website glasshalffull.online. Glasshalffull.online.